Hello, Dr. Christopher back with you for Unit 2, Part 3, Contact Tracer Training. And we're going to look at diagnosis and transmission prevention. So basically there are two kinds of tests that we've been using to diagnose COVID-19. Uh, the, uh, the PCR tests, which are polymerase chain reaction tests, that give a sign of whether the virus is reproducing in your cells, and the antibody test to detect whether or not, uh, it'll usually a blood test, whether or not you've had uh, the virus and maybe didn't show any kind of symptoms. Uh, so, but one of the things that we deal with is that these tests are not perfect. Uh, Oftentimes, you hear about tests having 70% accuracy. So they're getting a little better, but again, it's possible to test false negative, false positive, etc. So, how do we test for an active infection? The PCR test is the one usually done with people with signs and symptoms, and that would detect whether or not there's viral genetic material in your body. The swab test is generally used to determine whether or not you have it, symptoms or no symptoms. Uh, the swab test is the most common one used. We can also use saliva, but it's been difficult for people to come into access to these saliva tests, and they've had to take the more perhaps uncomfortable the swab test. A positive PCR test shows there's an active infection. Again, sometimes you test negative, but it's a false negative. Uh, it's why you might see how government officials are tested far more often than many people, just to prevent the spread at highest levels of government. So, as far as antigen tests, as far as antibody tests, the IgG is the most common antibody test. It's a blood test, and the body starts to produce these antibodies 10 to 14 days after infection. And with a blood test, we can see whether or not uh, uh, you've been infected in the past. It doesn't really tell you when you were infected. It can also mean that you're protected from future infection. We're not sure of that right now, but with trials for vaccines and when we're isolating people with these antibodies, over time we're going to be able to tell the length of their immunity if they have some after already having gotten it one time. As you can see, the two different types of testing, many people do complain about this uh, swab test, but have to endure this quite often if they are essential workers. And unfortunately, sometimes these tests take up to 3 to 5 days to get the results. So obviously, for the contact tracer, this obviously complicates the issue because people can certainly be spreading the virus while they're waiting for the results. Again, the antibody test is generally a blood test. How do people transmit this illness? How are they getting it? Well, we're always talking about wearing a mask, socially distancing. That's because people have these viruses in their mouths, noses, and throats. And when we're having a good time talking, laughing, coughing, sneezing, perhaps drinking, these droplets can spread into another person's mouth, eyes, or nose. We can pick it up through surfaces that's why we want to wipe off surfaces if we go indoors before we use them. Wash our hands often and wash them well with a good germicide. People who do shopping early in the pandemic noticed lack of these kind of supplies on the shelves. Of course, that has gotten better now. It's still very important to wear a mask and to socially distance and wash your hands frequently. People who are in hospitals are oftentimes more at risk for this transmission. You go in with one situation, you could come out with COVID as well. And that's very important that we isolate people in these hospitals. Again, these droplets, they can spread when people sneeze. They can travel sometimes beyond 6 feet, and they can land on surfaces. That's why we want to wear masks, not so much to protect ourselves, but to protect others in our community, and to set examples for people in leadership positions need to set examples of being mask wearers. Certainly, we want to avoid having the wearing a mask be a political statement. It is not. We want to make sure that we want to prevent as much transmission as possible, because we know that people are infectious even before they have symptoms. Another reason to wear masks, because you don't know if you've had it. You really need to act as if you've been exposed to it when you go out there. Again, some people never develop symptoms, but certainly we need to test symptomatic people as well and identify their contacts as quickly as possible. And transmission, again, in crowded events, in indoor events, with physical contact, close contact, inside of restaurants and offices, bathrooms, people who share beds, share food. Your transmission is obviously more likely with these closer contact. Transmission is more likely between people who live together. You often hear of people who are, if they're fortunate enough to have more than one level of the house, maybe isolating upstairs or in the basement if they have it, and certainly walking around with masks. Obviously, people who live in congregate housing, people who live in close quarters, are more at risk. This includes people who are in prisons, in jails, in group homes, college dormitories, homeless shelters. These people are very much at risk, and they oftentimes, when you're dealing with a prison population, you're dealing with minority population already at risk more for COVID. And by living in these close quarters, we not only risk their health, but the people who staff these places as well. Many have complained about not having sufficient protective PPE provider gear to wear in these cases. And again, remember that the window of opportunity is very small. We got to get people, we have to identify contacts as soon as possible after they've been exposed, and notify them and advise them and encourage them to do the right thing regarding isolation or quarantine, depending on what's appropriate. We talked earlier in Unit 1 about how this disease can spread. And some diseases, part of the issue is the reproductive number. The number of people one infectious person will infect if that person has contact with somebody with an illness. So it's a good way to measure how fast a disease can spread. The higher the reproductive number, the more people will be infected. As you can see, a reproductive number less than 1 infects very few people. A reproductive factor of 1 infects 1 person per every case. And then we get into 2 or more where we're doubling or more the number of cases. So, so how many people will one person infect depending on the illness? How many people can this one person affect? And you take a look at, again, nursing homes. And, nursing homes are more higher risk because of people older age, multiple underlying conditions, need for people having more needs, more multiple interventions. And so the need for staff is already great. And when staff gets sick, they get more impaired and the situation gets worse because nursing homes are really not hospitals and not set up for severe infections. And we don't want to send our severe infections. We've learned from that as well. But as far as this infectiousness is concerned, you take a look at other historical illnesses. Measles. Measles is not really considered life-threatening anymore. Measles is the most infectious virus. People get measles. One person gets it, can give it. It has an RO of 15. Can you imagine if COVID was like that? It's already bad enough. The MERS, reason that MERS didn't spread like COVID has is its reproductive number was less than 1. So the disease spread was obviously less. But this COVID, and as well as the flu, the general flu, we got an RO number somewhere between 2 and 3. So obviously, as you can see, even small numbers can create large outbreaks, as we demonstrated before. Imagine if this number were 3, and how one person would even more spread would take place. So, and consider that this reproductive outbreak number is obviously going to be greater in a nursing home or in a prison. And finally, think about how important a contact tracer's job is because just eliminating contacts, just by warning contacts before it's too late, how much impact we can have on preventing spread in our community. I'm Dr. K, and I will back with you again for Unit 3, Part